Hey, thanks for joining me today for Mobility Monday. I'm Jeff Blanchard with Therapeutic Associates Physical Therapy, and today we're going to talk a little bit more about that hip pain that you might be having. And in the previous episode, I talked about 3 different locations where that hip pain might be coming from. Today, we're going to be talking about the notorious back of the hip problem, where that's probably coming from, and what are a couple things that you can do to start working on that. All right, so if you're having that pain in the back of the hip area or kind of in the buttock area, one of the things that you can do is to try to do just a couple tests to see, is this coming from my back or is it not? So what you might do is first take an inventory of what your pain feels like. You might be like, okay, my pain is, maybe it's a 3 out of 10 right now, and I'm feeling it right in this spot, right in the center of the buttock. So then monitor your pain as you do a couple of different motions with your back. So let's say first, go into this motion, bend forward. Does that pain in the buttock, does it get better? Does it get worse? If it gets worse, that means one thing oftentimes to us. There's a certain diagnosis. If it gets better, that means something else to us that helps us with that diagnosis. And then there's going in this direction. Okay, again, does it make it better or worse? Going to the side one way, going to the side the other way. So do these directions make things better or worse? Now, if forward bending makes you feel better, then that might be the exercise you want to do. You want to do a little bit of forward bending exercise to get this feeling better because it actually feels good when you do it. If going this direction feels better, then we'd want to go and do an exercise in this opposite direction to take your spine back that direction. So with our patients who are a little bit older and they're starting to get some loss in their spine, maybe some disc degeneration, oftentimes they'll find that forward bending gives them some relief. So one of the exercises I might have them do is a child's pose exercise. We demonstrated that one a couple times ago. And that might be, you would just be here in this position and you would get down here and do a bit of a stretch to stretch that back out and see if it makes that back of the hip area feel better. And so let's say you're a little bit of a younger person, you're in your 20s, 30s, 40s, and you find that this makes things feel a little bit better and this makes it feel worse. So that would lead us to believe that maybe we have a little bit of a disc issue going on. That more commonly affects people in their younger to mid years. So we might have you doing an exercise where you're actually doing this and you're doing this stretch on a regular basis to actually take some of the pressure off of the disc if it feels comfortable. You could also do that on your belly. Here, come up into this position and then working on stretching the back in this direction, seeing does this make me feel better? Does this help decrease my pain back there in the buttock? That's just a very little bit of something that you might be able to do for both of these things. We're talking actually about a much bigger picture that if you're having this kind of a pain and you'd like to get more to the depth of it, that would be when you would want to come in and see us and have us take a look at things, because we can then really tell you, okay, this is what's going on, this is the diagnosis, and these are a number of exercises that you can do. These are some things that you should be avoiding in order to get your back to calm down and to get that pain to go away in your buttock. Really best to come in and see us. If it's been there for a couple of weeks and it's still bothering you, would really be the best time to give us a call and come in and see us. Okay, so that's a little bit about the spine and the spine creating pain into that area. There's the next joint below the spine, which is your sacroiliac joint. All right, so let's look at the sacroiliac joint. So this is the joint between the sacrum, which is at the base of the spine, and the pelvis, or the ilium, so sacroiliac. I'm sure that you've probably heard of that joint. Some people will come in and say, yeah, my sacroiliac joint's giving me pain back there. So this is a very stable joint, and because there's a lot of force that goes through this joint, there's a lot of ligament structure and muscle structure around this joint. So most often when people have pain here, it's coming from their spine. It's less common to have pain coming from the sacroiliac joint, but it is possible. Definitely if you've had a baby recently and your pelvis has been through that kind of trauma, your sacroiliac joint has got to go through a lot of stress in order for you to have a baby. There are some injuries where if you fall in a certain way and you land on an area, that might cause an injury to the sacroiliac joint. The number one thing we notice when there's a sacroiliac joint problem is when you stand on that leg, there's sharp pain that occurs right at that spot there, kind of center buttock region. And so you don't want to do exercises where you're on one leg or anything where you jump up and down or running or any of those kinds of things, because that's too much force going through the sacroiliac joint. So one thing that you can do in order to see if this is where your pain is coming from is you might compress your pelvis with your hands. You can actually take your hands and squeeze your pelvis together and actually create more stability at that joint, and then see if stepping on that side feels a little bit better. So you can compress and say, okay, does that feel a little bit better when I put pressure through that side? Or you can have somebody else squeeze through your pelvis and see if it feels a little bit better on that side. There is something called a sacroiliac belt that you can get online that you could put around that would do that, and you could actually use that to give you some compression and help decrease the irritation at that joint. And then there are other exercises that we could get into a little bit more if you were to come and see us for a sacroiliac joint problem. Okay, the last thing I want to talk about in regards to pain in the back of the buttock is the hamstring. The hamstring are these big muscles in the back of the thigh that come up and attach to the base of the buttock. It's to this bone right here, which is located on the bottom of the pelvis. That spot is very responsible, allowing you to be able to go down and pick things up. I've had people injure this thing because they do too much bending and lifting or too much weeding in the garden or something like that, where it just creates an irritation of that muscle and that tendon that attaches to that spot. So you'll notice it because it'll be painful for you to sit right on that spot. It'll feel like you just have something jamming into that spot there and it's kind of sharp. Sitting in the car is painful. Sitting on especially a firm chair is painful. And so that's just because the tendon, where the tendon attaches to the bone, is really irritated. So the last thing in the world you would want to do for that is stretch it. If you stretch it, you'll make it worse. So do not stretch a tendon that has been irritated, because that will make it worse. What you want to do is you want to start gradually strengthening it and making sure you don't stretch it and you don't do a lot of bending so it has a chance to calm down. So I'll show you an example of an exercise that you can do to start strengthening this muscle that typically is not painful. Okay, so here's an example of an exercise that you can do to start working on that hamstring that's giving you the pain in the back of the buttock. So you want to be lying down with your knees at about a 90-degree angle. You might put your feet up on a chair if you're on the floor, or on a couch if you're on the floor, or you can use a ball like what I'm doing right now because I'm here on the table. And so basically what you're going to do is you're going to do an isometric. So an isometric is when you use a muscle and you hold for a certain length of time. So what I'm going to do is I'm going to push and I'm going to lift myself up and I'm going to hold this position for, I'll start off with like a 10-second hold. You can see I'm wobbling around a little bit because I am using a ball, and I'm keeping my knees bent, and I'm really using both of those hamstrings that are attached to that spot that we were looking at. And then I'll come down and take a little break. So if you're starting to work on an exercise like this for a tendon problem, you're going to want to do about 10 seconds on, 10 seconds off. And as that gets better, then you're going to want to do 20 seconds on, 20 seconds off. And then eventually 30 seconds on, 30 seconds off. So you want to gradually build your tolerance to being able to come up and put that force through that tissue and have that tissue hold you in this position. There are other exercises that you could then progress to that are more challenging as the tissue gets better and more tolerant to force, but that would be a good place to start. we'll probably have a future episode a little bit more on hamstring problems, because this is something that we do see frequently. So look forward to a future edition of Mobility Monday about hamstring problems, where we could get more into depth about these exercises. So thanks for joining me today for Mobility Monday. If you know somebody who's complaining of back of the hip pain, then send them to this video and have them take a look and see if they can start figuring out, where's my pain coming from. But better yet, send them our way, have them give us a call so we can help them figure out where's the pain coming from, why is it going on, and what they need to do to get it to resolve. All right, so join us again next time, but remember, until then, that motion is lotion.